Question number 4, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Has the increase in health funding for 2013-14 been sufficient to stop cuts in health services and staffing?
Come on, Pitbull.
Honourable Tony Ryle.
Mr Speaker, the increase in available health funding for this year and for the next 4 years, averaging around $400 million a year, has actually been sufficient to improve, not reduce, frontline services and staffing, like the 2,700 more nurses and 1,300 more doctors employed in our public hospitals. The government is, however, very aware that there are always pressures on providers, such as on some general practices offering low-cost doctors' visits to some in our most vulnerable communities. Consequently, while we have already increased the very low-cost access scheme subsidy to these practices by $11 million over the last 5 years, that's by 33%, it's clear that some are finding it difficult to remain viable, and later on this afternoon, the government will be announcing an increase of a further $16 million over 4 years, or an 8% increase to help these practices out.
Supplementary question, Honourable Annette
Well, if DHBs have sufficient funding, why has Waitemata DHB now confirmed they are cutting mental health charge nurses in mental health units by 50%, have told staff they intend to slash the numbers of mental health administrators by 14%, and are removing cars from public health and community nurses because of, quote, continuing cost pressures coupled with lower funding growth?
Honourable Tony Ryle.
Mr Speaker, my understanding is Waitemata DHB is continuing to invest more money in its mental health services, and that would certainly meet with the fact that we put an extra $31 million extra into the Waitemata DHB in this year's budget.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. If the funding is sufficient, why is the Waitemata DHB proposing to cut 10 doctors from the emergency department, not for clinical or quality reasons, but to save money? And doesn't this make a mockery of his letter of expectation to DHBs, where he said they need to, quote, improve clinical staff retention?
Honourable Tony Ryle.
Mr Speaker, this is sort of what we've come to expect from this member, because while she talks about...
Mr Speaker, point of order. Point of order.
Order.
It was a straight question. There's no need to have the beginning of his answer.
And I agree. Would the Minister just answer the question?
Mr Speaker, my understanding is there's a consultation which will see the staffing mix at Waitemata Emergency Department change to reflect the staffing mix at Auckland County's Manukau. But I cannot believe the opposition would ask a question about the North Shore Waitemata DHB Emergency Department when under their watch old people waited for 3 days on hospital trolleys under bright fluorescent lights, and they don't do that anymore.
That answer is quite sufficient. Supplementary question, Chris Ockenville.
Thank you, Mr Speaker. My question to the Minister is, what progress is being made to improve health services on the West Coast?
Honourable Tony Ryle.
Mr Speaker, I'm pleased to advise the member that later this afternoon the government will announce that it has given the green light to a brand new West Coast hospital to be built at Greymouth at an estimated cost of around $60 million. This new development will replace Grey Base Hospital with new wards, an emergency department and new operating theatres. It also will include an integrated family health centre which will co-locate general practice on the Grey Base Hospital site. The Grey Base Hospital's facilities have significant seismic issues, so this announcement is important for the 32,000 people who live on the West Coast and gives them confidence in the future of their health services. Site work is expected to begin late next year, with the new hospital and facilities to be completed by the end of 2016. And even in the most difficult of economic times, this government has found $60 million for that member's electorate's hospital.
Supplementary question, Mr Speaker.
Order. Supplementary question, the Honourable Annette King.
In light of that answer, can he guarantee that with the building of the new Greymouth-based hospital, Reefton Hospital will not be closed and patients shifted to Greymouth?
Mr. Speaker, what I can tell that member is, well, I give this assurance to the people. I give this assurance to the people of Greymouth. We're putting $60 million in, and what's more, I can say that there will be a further announcement this afternoon on a further investment on the West Coast, and I say to the member, wait for that.
Supplementary question, Mr. Speaker. Oh, well, that's good news. Look forward to it.
Supplementary question.
Is he aware that the beg your pardon, the member, the Attorney General, did you hear that, Mr. Speaker?
Order. That level or that type of interjection is totally unhelpful to the order of this House. Would the honourable member start? Order. Would the honourable member start a question again?
Well, he just did it again, Mr. Speaker.
Order. I didn't catch where that interjection came from, but order. We're getting to the stage now where, unfortunately, I am going to be asking members to leave who constantly interject. And that is a warning I'm giving to all members, both sides of this House. I ask the Honourable Annette King to continue with her line of questioning.
Thank you, Mr. Speaker. Is he aware the emergency department at Waitakere Hospital is being discussed at a closed board session today? And if so, will he guarantee that the emergency services at this hospital will not be compromised by a lack of funding and staffing?
Honourable Tony.
Mr. Speaker, the Waitemata DHB's budget has increased by $30 million this year. There are 268 more nurses and 114 more doctors. And what I can say is this government's record with the Waitakere Emergency Department is we have improved that service beyond whatever existed under that government opposite. We now have 24-hour emergency department services at Waitakere Hospital, far more than that party opposite ever delivered those people.
Mr. Speaker.
Order. Supplementary question, the Honourable Annette King.
Did he raise the amount of funding Waitemata DHB received when he phoned the Chair and the CEO to pressure them after being questioned about proposed cuts in Parliament 2 weeks ago? And did they tell him that under his watch, the additional funding this board has received, 2013-14, is half what they received in 2007-2008, which might account for their current financial situation? And he might like to have a look at the level of increased funding that he's crowing about that is now halved.
Honourable Tony.
Mr. Speaker, I just have to say that I'm glad the member has admitted finally that this government increases health funding, because she constantly paints the picture that we've reduced health funding. We've increased it year on year on year, an average of $500 million. And I can tell this to the people of Waitemata, because of our investment in a 24-hour emergency department at Waitakere and tens of millions of dollars in a new emergency department at North Shore, they are getting faster and better emergency department care than was ever offered when that member was the Minister of Health.
Speaker.
Point of order, Honourable Annette King.
Mr. Speaker, I seek leave to table a copy of the Minister's letter of expectation, which is not readily available, saying that he wants DHBs to improve their staff retention.
Leave sought to table a letter from the Minister, expectation letter. Is there any objection? There is objection. Order.
Point of order, Mr. Speaker.
Point of order, Honourable Annette.
I seek leave to table a copy of the consultation document from Waitemata DHB on mental health services, 26th of August this year, which states cost pressures and lower funding growth are the reason for cuts.
Order. Is that document freely available?
No, it's not available.
Order.
Mr.
Leave
Speaker.
sought to table the consultation document. Is there any objection? There is objection.
Oh, poor old brown bag.
Order.
Point of order, Mr Speaker.
Point of order, Honourable Annette.
I seek leave to table a graph of additional funding per year at Waitemata DHB.
Order. Is that the graph the member was using?
Here is the graph. Wait a minute,
I'm not
Mr Speaker.
prepared to put that leave.
Mr Speaker, point of order, Mr Speaker.
Order.
Can I please know why you wouldn't let me table a graph that comes from district annual plans?
I'm happy to catch up with the member and deal with her later on some Speaker's rulings. If it's a seeking leave, if it's a graph that's been prepared for a political point, it's not an order.
Well, you want to take it?
Point of order, Mr. Speaker. Point of order, Mr. Speaker.
Point of order, Grant Robertson.
Mr. Speaker, the graph in question comes from the Waitemata DHB planning department and from their annual plan process. So it hasn't been prepared for any purpose other than by the Waitemata DHB, and I think you should put the leave.
Order. I have already ruled that I'm not putting the leave. Question number...
point of order, Mr Speaker. Point of order.
Fresh point of order?
Yes, no, I want to table another document.
Fresh point of order?
I want to table an email sent to John Key, Campbell Live and myself from a constituent from North Shore about the lack of proper care at North Shore Hospital because doctors and nurses have said there is not enough funding.
Order. Leave us sought to table that particular email. Is there objection? There isn't. There is objection. Question number 5. Point of order, Grant Robertson.
Mr. Speaker, I do think we need some clarity from you around what is the basis of the ruling. I accept that there may be a Speaker's ruling that we aren't aware of, but it would be good to know because there will be other occasions we want to table documents like this.
There will be, and I suggest the member look at a page full of Speaker's rulings 148.
A little bit of homework to do, Grant, Mr. Speaker.
Point of order, Honourable
A page full of rulings will have about half a dozen different reasons. I think what my colleague was asking was for the reason on this occasion.
Order. The member now is disputing my ruling, which will lead to disorder. There are a number of rulings there. I'm suggesting he read them all, which would help him. Order. I'm on my feet. Now, is this a fresh point of order?
Point of order, Mr. Speaker. Point of order. It's seeking clarity from you, Mr. Speaker.
Is it in any way disputing a ruling I've made?
No, it's not disputing. It's seeking some clarity.
I will hear from Chris Hipkins.
Thank you, Mr. Speaker. Mr. Speaker, I'm relatively familiar with the issue of tabling of documents because you'll be aware that it was raised by the Standing Orders Committee of the last Parliament, and significant changes were made to reduce the scope for the tabling of documents. But the critical issue there was that the Standing Orders Committee did not want to in any way curtail a member's right to seek leave. They wanted to provide further clarity as to what was legitimately to be tabled. Information that's not publicly available is a legitimate thing for a member to seek to table. And the Standing Orders Committee was very careful not to overly restrict what sort of format that might be in. So I just want to get some clarity. Annette King indicated that the document she sought to table was not publicly available or may not be available to members. The principle behind the tabling of documents is it's in order to provide members with information that they might not have readily available to them. And it seems to me that without hearing a proper description of the document and without actually putting it to the House, we can't judge whether the House would like that information.
I thank the member for his point. The issue I think that may be of confusion to me is the authenticity of the document. If it has been prepared by the member for the point of making a political point, then I will not be prepared to put the leave. Now, if the member rises and say it hasn't been prepared by the member, it is of authentic source, then the easiest way forward, the easiest way forward, once I'm convinced of that, is I will put the leave. I'm asking the Honourable
Mr. Speaker, the data is sourced from the Waitemata District Health Board's annual plans, 2008-9, 13-14.
Order. I did not ask where the data came from. I asked of the authenticity of the graph. Is it a graph that the member has prepared herself?
Yes, Mr. Speaker.
That's all I need to know.
Mr. Speaker,
that is all I need to know.
Point of clarification, Mr. Speaker. Could you please explain to the House? Well, I'm entitled to ask for order in silence. Would you please
Would the member please continue with the point
Could you please explain to the House when sources of information that come from an independent source are a political item?
Order. What we're talking about here is the tabling of a document that the member herself has prepared. I invited the shadow leader for the House to have a look at Speaker's rulings, and he should do so. If it has been prepared simply for the point of making a political point by the member, it's regardless of where the data has come from, I'm not prepared to put that leave. And that is the end of the matter. And if any member further wants to question it, I will have no choice but to ask that member to leave the chamber. Question number 5, Dr. Russell Norman.